Yes, I have a particular patient in mind. This is a young man that came through the agricultural worker program into our care several years ago. This individual was just 22 years old at the time. He's somebody who may not have who may not have been able to seek care or may not have known how to seek care if it weren't for the outreach services that we provided. He lived in a very isolated area where there was no cell phone reception, without any reliable form of transportation. Our outreach team encountered this individual and registered him for the program and provided him with kind of our card for the program, which is helps to identify him either at Keystone Health or at Family First Health or any of our contracted health centers as an agricultural worker who's with our program. So he, was given those resources, and he was able to contact our program when he had a health need. So he came in because he was having some fatigue and some pain in both of his knees at the time. He saw one of the bilingual providers, and that provider was able to pick up on the fact that there was something a little bit, something was definitely wrong here. Something was, this wasn't the typical case of fatigue or the typical case of knee pain, and did some lab work and found that this 22-year-old man had end-stage renal failure. And really critically abnormal electrolyte values. So we got this information, I think on probably a Wednesday or Thursday evening, and had no way of contacting the patient. So this is someone who could have easily fallen through the cracks. Already at several of these steps, this person could have fallen through the cracks, but luckily with the kind of outreach program that we have, we were able to actually find the individual where he lived and helped him to get to the emergency room that same night. At the emergency room, we were able to, with our outreach services and our care coordination services, we were able to communicate with the hospital and the social workers to make sure that he got the care that he needed and that he was able to be scheduled for the follow-up that he needed. He ended up needing dialysis treatment. He ended up very, very fortunately being able to, afford everything that happened in the hospital because he was able to access the emergency medical assistance that's available to some people who are uninsured who have emergencies and end up in the hospital. And he was actually, with that emergency and medical assistance, able to get ongoing dialysis for the remainder of the time that he was here in the United States, and he was able to continue working. So, after that point, once he'd been discharged back to the community, he continued to follow up, and we were able to, continue to address his medical needs and to coordinate his care with specialists. We were able to provide a lot of communication with his employer because we have a very close relationship with many of the agricultural employers in the area to help make sure that this individual had, a good outcome and was able to successfully continue his period of work here in the United States. We found out after he went back to Mexico about a year or two later that very fortunately, he was able to access some of the safety net system in Mexico and to get some funding through a couple of foundations and a kidney from his brother, and was actually able to get a kidney replacement. So he is, on track to live a long life. But if he had been here, and there had not been a program that was able to reach out to him and provide these resources, and if there had not been community health centers like Keystone Health and Family First Health to help coordinate his care and to kind of, push at every step of the way to make sure that he got everything he needed, I think there's a very good chance that he would have had a poor outcome, that he may have even died during his time here. So that's one example of, that was kind of the heroic efforts, really, not only of community health center, not only of the community health center involved, but also, every individual involved, the hospital system involved, the whole safety net really served this patient well. And they were able to avoid falling through the cracks because of a patient-centered medical home that was able to kind of put the pieces together and keep the pieces together all of the way for him, so that he, had a good outcome when there are so many things that could have gone wrong and probably would have gone wrong if not for, community health centers who really, really know how to reach out to patients and understand their needs and their social determinants of health, and can provide that kind of glue to, to make sure that everything stays together and that they have a good outcome.